Today we'll talk about 3 different types of occupational therapy settings and how to figure out which one's the best for you. And it turned out being one of my favorite settings to work in, and I knew it because it felt so natural. And yes, it was challenging. I liked the variety. I could get lost in a pediatric book. It was a lot of fun, and it ended up being the field that I chose, even though I was really intimidated by it. It is a great setting if you are an out of the box thinker, requires a lot of patience, and you just gotta love kids. For my field work, I worked in a critical care unit, and the occupational therapy assistant that I was working with was kind of a floater. So we worked in a cancer unit. Occasionally, we would go to a burn unit or just regular critical care. And it's usually like right after or immediately after surgery or an event or accident, something that might have happened, and quite a few of them were comatose. So in that setting, you'll see a lot of range of motion, a lot of functional mobility, and a lot of basic self-care tasks. Like, it's a great setting if you like fast pace. We're kind of in and out of the room in under 15 minutes, like 7 to 15 minutes you get with each person. So it's fast paced. You might see 30 to 40 people in a day. But the day goes by very fast. You're on your feet constantly all the time. Because of insurance, they require them to have 3 hours of therapy a day, and that is usually split between physical therapy, occupational therapy, and sometimes speech, depending on what they need. So you're going to be spending at least an hour and a half with that person, and it's usually broken up in 30-minute segments throughout the day, or you might have them for an hour, and then you'll have group sessions. It's great if you like having more one-on-one time. You get to establish more of a relationship, and you can see the progress of them when they first come in, maybe not being able to stand up on their own to being able to walk 10 feet. It's like great if you like to see the progression of someone, and it's a very rewarding experience, but it is also probably one of the hardest and high stress situations, and even more so than critical care. In that setting, it was in a hospital, it was a skilled nursing unit, and this is right after they come from critical care, or it could be like after surgery, whether they have like a shoulder replacement, hip replacement, and it's where they go if they require like a step up from inpatient, but they may not be able to tolerate a rigorous schedule of an inpatient facility. So there's a lot more like stretching or just weight training or cardiovascular training where they're on the arm bike. And I believe we were in there for about like 30 minutes to an hour with a person. So you'd see about 5 or 6 people a day. And it's much more laid back. It's not as fast paced. You just have a set amount of patients that you have to see in the day, so you can make your own schedule. And it was not as exciting as the other ones, but it's really laid back. So I think skilled nursing is for you if you're more of like a laid back person, and yet you still like to make a connection with somebody. And the stay is not as long, it's about 10 days. Whereas an inpatient rehab, you're going to be there for up to 2 weeks, so you're there for a lot longer. But it is a great setting, and let me know what you think. Comment below. Let me know what your favorite setting is, what different questions you might have, or if you had similar or different experiences than mine. Thanks for stopping by.